So today we're about to talk about the cardiac pathology, and I would like to do a little review about the cardiac anatomy. And here, what we see in here is the coronary circulation, and the most important thing is that the arterial supply to the heart is from the right and left coronary arteries, rising from the root of the aorta. Here we can see the right coronary artery and the left coronary artery. Right coronary artery gives the acute marginal branches, the atrioventricular nodal arteries, the posterior interventricular artery. And the left coronary artery has two major branches, the left anterior descending artery and the left circumflex artery. And after that, I'll just jump ahead and go talk about the different layer of the heart. And here we can see that the layer of the heart has endocardium, the myocardium, and the pericardium. The pericardium itself is divided into visceral pericardium, the pericardial spaces, and the parietal pericardium. And you can see in the other side the valves. So the tricuspid valve is separate the right atrium and the right ventricle. The pulmonic valve separate the right ventricle from the pulmonic artery. The mitral valve separate the left atrium from the left ventricle. And the mitral valve has two cups, and all others have three. So aortic valve separate the left ventricular and the ascending aorta, as we can see here. So right after that, to finish with the cardiac anatomy, I will just go ahead and talk about the conduction system. So in a normal heart, rhythm is controlled by the SA node near the junction of the SVC and the right atrium. So impulses from the SA node travel through the atria. It goes to the AV node, to the bundle of His, and the bundle of His split into left and right bundle branches. So left bundle branches split into anterior and posterior fascicles. The Purkinje fibers from the RBB and fascicles of the LBB conduct impulses to ventricular myocardium. So I'm not going to really spend more time talking about the cardiac anatomy, or just jump ahead and go and talk about the diagnosis of some common presentation about cardiac pathology.